My name is Dr. Samuel Schenker. I'm a trained neurologist that transitioned into interventional pain management and minimally invasive spine surgery. I found a great interest in the area of pain management originally, and I was one of the first neurologists, I believe, to have coined the phrase cervicogenic headaches, which means headaches originating from the neck area, especially after whiplash injuries caused by motor vehicle accidents. After having practiced neurology for approximately 13 years, I entered the area of interventional pain and was trained by anesthesia from Robert Wood Johnson in New Jersey, an assistant professor there who took interest in my interest in the area of interventional pain, and subsequent to that had gone into minimally invasive spine surgery such as endoscopic rhizotomy and endoscopic discectomy, as well as all the other areas of intervention, including all those forms of epidural injections and diagnostics of the vertebrae, specifically the disc areas, performing multiple discograms, and on in that area of pain management. I had caught on with interest because I had spent many years in Spain looking at the culture and the customs of the Spaniards with regard to their lifestyle, and looking at the aspects of obesity, longevity, all these things, and it basically caught my eye over the years having lived there. And having returned to this country, I'd found that our eating habits, our customs, our lack of longevity is due to the fact that we don't incorporate healthy habits. Our habits are unfortunately dealt with and advertised through the industrial mechanism, even including that of big pharma. All of which, unfortunately, is in many instances corrupt and has created a great deal more illness in our society than better in many aspects. This is why we're number 37 in the world in terms of longevity. Spain is amongst the top 5, if not top 10 in the world in terms of longevity itself, being number 1, Japan. However, if you look at Japan itself versus Okinawa, in actuality, Okinawa is number 1 in the world, and Japan is probably number 2. So looking at this model of health and having had the experience of one particular patient who was a 35-year-old bodybuilder who was on the cardiac transplant list at Beth Israel in New Jersey and had 30 days before he would receive a transplant, was referred to me on the whim of the possibility of his having some form of remediating his cardiac status. So, having done so, he came to my office and he told me his plight and that he would be getting a new heart in 30 days. In cardiac terms, he had what was called a 50% ejection fraction, which means that the ability of the left ventricle to pump out blood was extraordinarily compromised, and had an apparatus in his chest in order to do so as well, as we call an LVAD, or left ventricular assist device. Having heard that, he had asked me if I had anything up my sleeve that might help him not get this particular surgery. And I said I hadn't walked on water in quite a few months, and I would work on that. But the thing is, I had chosen some knowledge of things that I did with my athletes, since I'd been in martial arts for 35 years, and trained them nutritionally. I chose CoQ10, or Coenzyme Q10, which is a intermediary for mitochondrial metabolism, which mitochondria are our energy cells in our body. And apparently it seemed that this could have been depleted. So having had this epiphany and choosing this particular element, I started this patient on 1,000 milligrams a day. And after that, in 30 days, he was off the cardiac transplant list. So having taken that lead, it really inspired me to look into other areas of health and regeneration. One of those areas in particular is male health. And as part of that, erectile dysfunction and hormone balance became extraordinarily important. One of those examples is head trauma, where I was led then into that aspect of erectile dysfunction, having treated soldiers from Iraq, Afghanistan with head trauma, and having found that they had severe depression, loss of libido, erectile dysfunction, and all these aspects. I therefore started looking at them. Instead of giving them antidepressants, I was looking at their neuroendocrine function, which means, in other words, the hormones that are secreted in the brain. And by doing so, found that he had very low testosterone at 27 years of age. I treated him with hormones, specifically Clomid, which is used in women, but also acts in men to stimulate testosterone. I changed his diet. I gave him specific supplementation, including that of CoQ10 and many other supplements to improve his brain recovery. And in 30 days, I saw him back in the operating room since he was my surgical tech. He had lost a tremendous amount of weight. He looked great, almost to the stage as when he went into the military. And he had said that he was the happiest man in the world. He felt extraordinarily ecstatic how he felt. And I asked him how his sex life was. And he said that his wife loved me. And so, having heard that, basically, again, it stimulated my need to research further. Having done so, we now discover that erectile dysfunction in men who are middle-aged or younger sometimes can be the lead-in, not only because of hormone loss, but it can essentially be interpreted as early stages of cardiac disease. The idea of erection is based on vascular dilatation or opening. And so if that's compromised in any way, and many other factors can do that, such as smoking, high blood pressure, diabetes especially, high triglycerides, a whole bunch of factors can impede vascular dilatation and obstruct those small blood vessels. So we're thinking that if you're undiagnosed as a cardiac patient and you have these vascular issues associated with your erection, then this could be the early start of cardiac disease as well, if everything else is excluded. So the research in Israel and Germany had demonstrated that, number one, if you apply and bearing in mind that having taken care of all these other factors and you still have erectile issues, then they did this study of utilizing specific shock therapy to the penis will break up these obstructive elements, and in many cases it can be what's called mucopolysaccharides that obstruct those small blood vessels. And virtue is like plumbing. If you shock enough into a tube that's obstructed, it causes cracks in the inner wall of those areas that obstruct those blood vessels and essentially allow more flow into the circulatory system of the penis. So they did this experiment in Israel and Germany and had written these articles and found that men who received this form of shock therapy improved dramatically their erectile capabilities. Having said this, shock therapy then came to the United States, utilizing a specific machine or mechanism of action called the Storrs machine, and that was used for soft tissue injury. It now is being used for erectile dysfunction. It will probably help most men up to 80% with their erection. To complement this, they also discovered that if you use platelet-rich plasma, which is extracted from your blood after it's spun down to separate the red cells from the plasma, and within the plasma are your platelets, you can then take those platelets and then inject them with a very small cosmetic needle, and of course, gentlemen, under local anesthesia. And basically what we will do is apply a topical anesthetic, and if you're still sensitive, do a penile nerve block with a very small needle, inject anesthetic liquid such as xylocaine, lidocaine, and in about 1 to 2 minutes, you're not going to feel anything. So we then inject with that cosmetic needle into the shaft of the penis, and that will create regeneration of blood cells as well as nerve. So therefore, the element of stimulation and erection is enhanced not only by the shock therapy, but also by the injection of platelet-rich plasma. All these forms are encompassed in the title of regenerative medicine. So PRP was one of the first ones in that regard utilized. We can then take it a step further and utilize stem cell-like materials such as Wharton's jelly, which comes from the umbilical cord, and inject that in the same way into the shaft of the penis and do that. This same technique is also used in women. So women who've lost their libido and have lost their stimulatory capabilities of reaching orgasm can also be improved by utilizing this technique as well. And so obviously they don't have a shaft, but in other words, if you look at a female to male, the equivalent of penis and testicles are ovaries and clitoris. So these can all be enhanced in the same manner, but technically a little different. But yet it can demonstrate incredible improvement in terms of one's own personal life. So a lot of men specifically nowadays, because of the stress factor, the excretion of cortisol from the adrenal glands, which suppress a lot of the activity of hormone activity, as well as obesity, mental fogginess, suppression of libido. All these things are in New York, all surrounding us, and all in the large capitals, only because of the fact that stress will create these factors, as well as our eating habits. Nutrition, for my athletes, at least how I train them, 75% of your performance is nutrition. Unfortunately, a lot of the team's coaches didn't understand that, but on some teams that I approached and gave them this form of instruction, dramatically improved their performance. The same way with libido and erectile dysfunction. You can change and improve your performance by adding nutrition and specific supplementation that will enhance all this. So, bottom line is, men's health is being challenged, all right? Especially now, especially with COVID. The ability to meet people is extraordinarily difficult. Having personal relations is more stressed. And so therefore, you will find that this new age of COVID will be a factor in increasing the idea of erectile dysfunction, extending it into all areas, specifically in the Western world, where the stress factors are heightened in that regard. So this is one manner, including that of all the other factors I've included in this discussion, that will help all men improve their private and sex life. Pretty much in the executive and industrial world as we know it. Obviously, the information that you've been provided has taken many years to accumulate with regard to our capabilities and my expertise in the area of men's health. For that reason, if you have any questions, any desire to call us because of your specific needs, please do so. We're located in front of the beautiful Bryant Park by the New York Public Library. We are on the 12th floor at 501 East 5th Avenue. Please call us with the number that you'll be provided with, and if you have any questions whatsoever regarding anything from the areas of nutrition, cosmetics, or hormone balance, please call us, and we'll be happy to answer any of your questions. Thank you again. This is Dr. Samuel Schenker, always here at your service.